Good afternoon, everyone. Welcome to our October HSAC meeting. Please notice in the chat the login, the sign-in form. Please go ahead and take a minute and complete that. That's what I'm doing right now. Make sure that we are all appropriately registered and get credit for being here. I can't type and write it and talk at the same time. I know we usually wait a few minutes until we have a quorum, but I'm going to go ahead and officially call the meeting to order. If there are items that need a vote, and today we only have one, then we will just hold that item until we have a quorum, and then we'll vote on it later. Because y'all are wonderful to get here at the beginning, and we're going to honor your time and start the meeting on time. I'm sorry, I was just reading a comment that I got, email that I got in answer to an email I had just sent about starting the meeting. I meant the Zoom part of the meeting, not the actual meeting part. So anyway, so to start our meeting, I just want to go over the goals of the Homeless Services Advisory Committee. I apologize for the radio in the background. And I have no control over that. But our goal is to finish the job of ending chronic homelessness, prevent and end veterans homelessness, prevent and end homelessness for families, youth, and children, and set a path to ending all types of homelessness. Just a reminder, even though at this point in our virtual career, none of us should need reminders. Stay on mute if you're not speaking, if you would. You're welcome to be on camera, because sometimes we like to see your smiling faces. But if you are getting ready to speak, then you're welcome to come off of mute at that time. If you have a question, I would appreciate it during some of the presentations. There will be opportunities to ask questions. I'd appreciate it, just for the sake of making sure we don't skip anybody and don't miss anyone, to use your reaction button and raise your virtual hand so that we can call on you. I will call on those who have their virtual hands raised before I recognize others who are speaking in the meeting. So I appreciate if you would do that as well. So thank you for that. At this point, we will go ahead and move forward. I believe Julia Gamble is here. Yes, we have a public comment. Julia has asked to speak. I'll just, as a reminder, that is for 3 minutes. And Julia, whenever you are ready, you may start.
Thanks, Helen. I hope everyone can hear me. I wanted just to ask for us to honor the memory of the nurse practitioner who was murdered at Freedom House recently in the line of duty while serving a client. Her name was June Onkundi. There is a GoFundMe that the family has set up. She had 4 children, 16 and under, and they're looking for some assist with burial expenses. She graduated from nurse practitioner school this past June, was devoted to serving those with mental illness and substance abuse disorders, and had spent already much of her career as a nurse working at Wake Med in their crisis facility. I want to also mention that a Duke social worker at Duke Family Practice was attacked in 2019 by the same individual and was choked almost to the point of passing out and dying. In both cases, partners in the work, co-workers serving the underserved, people caring for those with mental illness and substance abuse disorders at Freedom House in one case and at Duke Family Practice in the other, rushed to the aid of their colleague and attempted to save their lives. So in honoring June at Freedom House, I want to honor her coworkers who were there that day when she was stabbed to death and responded valiantly to try to save her life. I want to also take a moment and recognize the individuals at the hospital who tried to save her life and all of the patients that were impacted that day as they were trying to receive services for their mental health and substance abuse issues at Freedom House, and who now, while Freedom House is closed to try to sort of find its way again after this trauma, those patients are not being served at that facility, can't go in the building right now. I want to also very clearly state that mental illness, substance abuse disorder are all journeys that many of us are on, and that recovery is possible, and that none of those things make any individual a criminal, and that the person who committed the murder committed a violent and criminal act, but that does not represent mental illness or substance abuse disorder. I'd like to ask this committee to potentially write a statement honoring the work of those at Freedom House and the memory of June. I'd be happy to participate in conversations about how to do that. Thank you for your time.
Thank you, Julia. I appreciate you bringing that to us. That is indeed a very tragic event, and it has so many repercussions in the community that we're only beginning to see. Would you be able to share the information about that GoFundMe in case anyone is interested? You maybe just put that in the chat real quick so that in case anyone's interested in knowing more about that, they can look into it. Looking at my notes for the next thing. There were no other public comments, correct?
Correct.
Do we have a quorum yet? Ah, perfect. Okay, in that case, HSAC members, you should have received the minutes for the June and August meetings. I hope you've had a chance to review those. Because at this time, we will accept the motion to approve the June and the August minutes.
Hi.
Hi,
Good
Alicia.
afternoon. I make a motion to accept the minutes.
All right. Do we have a second?
I second that motion.
Okay, thank you. And that was Shay. Do we have any discussion on the June or August minutes? Okay, then in the chat, put your vote. Yes, if you approve. No, if you do not approve. And abstain. I don't know why anyone would need to abstain from the minutes, but if you feel that you must, that would be fine too. Well, there would be a good reason, Jonathan. Thank you. All right. So it looks like the minutes have been approved. Thank you for that. I know we are still working on the September minutes. Our new secretary has needed an opportunity to catch up, so we'll give him that chance. It's not a problem at all. All right. The next item on the agenda is the Executive Committee Quarterly Report. And for that, you have me. We pretty much in the Executive Committee, we do a lot of work to get this agenda ready for you, to decide what's going to be in each meeting. And we try to do that by bringing well, obviously there's things we have to bring to you. If there's funding that needs to be approved by the committee, then we have to bring that to you. And we make sure that you have the information that you need to make an informed decision about that so that your vote makes sense. We also try to bring other people in that can contribute to our general knowledge about the homeless system, about services that are available for the work that is needed, the work that is done. And that just generally contribute to the knowledge base of HSAC and the COC members. And also, we're going to talk about this a little bit later too, about asking your opinion about some topics that you would like to hear more about that we can bring to you in future meetings. And we'll be talking about that later on the agenda. And then another thing that we do as the executive committee is solicit feedback from community organizations about housing options. The only other thing that we've done, or the main other thing that we've done, is completing the executive officer slate. And that was a challenge this year because everybody's busy. So we understand that, we get it. And I applaud the work of the staff to get that done, because it was really more them than it was us on the HSAC trying to get this done. Colin and his team did a wonderful job trying to make sure that we had an executive committee this year. And I thank you for that. But that's pretty much what the executive committee has done in the last quarter. Are there any questions about any of that? Well, in that case, we will move on. The next item on our agenda is a COC NOFO and North Carolina ESG update. And for that, we have Lloyd Schmeidler to present. Go ahead, Lloyd.
Good afternoon, Lloyd Schmeidler with the Community Development Department. I'm in the process of trying to share my screen. Hopefully you can see it. Would someone confirm that you can see my screen?
We can see it.
Okay, I guess I should start at the beginning. All right, so by way of reminder, the Continuum of Care annual competition, NOFO, was released around August 1st with the due date of September 30th, and the North Carolina Emergency Solutions Grants competition was released about July 19th with the due date of October 3rd. So these competitions nearly ran concurrently. Durham is eligible for quite a bit more funding in the annual COC competition than in the state ESG competition, as we'll see. So this is a high-level overview. The HSAC approved project priority rankings of the projects for the COC competition, as well as funding recommendations for the state of North Carolina's ESG competition at its September 14th meeting. So this first slide reviews the basic amount that we were eligible to apply for in the 2022 competition. The annual renewal demand was the amount of money that the 12 projects that received funding in the 2021 competition would have been eligible to apply for, or were eligible, I should say. We're eligible to apply for in the 2022 competition, so that they can continue to provide the projects, operate the projects that they are providing for people in the Durham community. The domestic violence bonus is as additional funds, specifically a portion of a $50 million nationwide bonus competition that HUD has been funding since 2018. And Durham was eligible for that amount. And then the permanent housing bonus is also some additional funds available for either rapid rehousing or permanent supportive housing. Additional funds for one of those kind of projects. The COC planning grant is not a competitive grant, meaning it does not need to be prioritized or ranked in our priority rankings as the other project applications do. It's available to the COC lead agency for specifically to help support the administrative responsibilities in implementing the administrative work of operating or supporting the operations of the COC. So cumulatively, we were eligible to apply for $2,269,000 and some odd dollars, as this explains. Next slide, if I can get to it. So two projects were reallocated. Part of our annual renewal demand, you'll recall we reallocated the home again and the Durham Crisis Response Center rapid rehousing projects, making over $312,000 available for those projects to fund new projects instead. So together, the new project and renewal project funding, apart from the COC planning grant, we had competition for $2,207,000 with the planning grant. Again, the grand total of $2,269,000. Tier 1 and Tier 2 funding breaks down the $2,207,958 into the Tier 1 amount, which is the amount that, as long as the project applications meet HUD's threshold requirements, would be funded. And the Tier 2 amount is the more competitive part of the competition. And in that portion, we had $404,000. Tier 2 funding is more difficult to obtain or receive from HUD. In previous years, Durham has only been able to get the straddle amount, to the amount of a particular project that might have some funding in Tier 1 and another portion of the project application, the budget in the Tier 2 amount. So this slide, what we want to highlight is that since we were reallocating 2 projects in the 2022 competition, the remaining 10 renewal projects only had $1,585,000 that they were applying for, which meant that we had $218,000 available for to apply and recommend for a new project funding. And you may recall the projects that we are recommending for that new funding. The first one was an expansion of the Streets to Home project at Housing for New Hope. Now, the domestic violence bonus project may be funded apart from this Tier 1 amount. And if it would receive that $206,000 that we referred to on the first slide, it would come out of our priority rankings for this Tier 1 funding. If it is not funded in the domestic violence bonus portion of the competition, it would be on the line straddling the $1,803,000 and the Tier 2 amount of over $400,000. But would there still be a sizable portion of the domestic violence bonus project in Tier 1, because the Streets to Home expansion is less than 100,000, so there'd still be 100,000 or more available for a DV bonus project. And then this last slide relative to an update on the COC competition provides kind of an interesting breakdown, perhaps, of the ratio of how our applications added up to the $2,269,000 based on project type. So we had 47.5% being applied for permanent supportive housing, nearly the same amount applying for rapid rehousing, and then much smaller amounts available for HMIS implementation, and again, the COC planning grant. We should point out that a couple of things about this in terms of the amounts given here. There's, I think, generally a recognition within the COC that we need more permanent supportive housing. However, the rapid rehousing portion of this 1,074,000 that's for rapid rehousing, nearly 500,000 of that is through domestic violence bonus funding, which the LGBTQ Center received a grant in the 2021 competition of over 284,000. And again, this year's domestic violence bonus project is over 206,000. So together, that's nearly 500,000. So, and domestic violence bonus projects, the requirements of the NOFO have been that DV bonus funds cannot be used to fund permanent supportive housing, but only rapid rehousing for survivors of domestic violence or intimate partner violence. So that is a challenge for using more of our COC funds for permanent supportive housing. Although we can say that the expansion projects that were applied were in this year's competition, the ones that were for permanent supportive housing were ranked higher than the final project that was an expansion of the Fresh Start project. And then just one slide about the North Carolina Emergency Solutions Grants application. We actually submitted both of these applications on the same day, on September 29th, one day before the COC application was due. The total of 172,255 was applied for. Roughly equal amounts were recommended for supporting the emergency shelter operations of families moving forward. The street outreach portion here was divided between open table ministry and the street outreach work of Housing for New Hope, and then the rapid rehousing portion here, which needed to be applied for either or used for either rapid rehousing or homeless prevention, was recommended for supporting the rapid rehousing work at Housing for New Hope. So at this time, I'm happy to take any, respond to any questions, or if people have comments. Any of my colleagues from the department wish to make additional comments about this information, we're happy to do so. The COC collaborative application, the priority rankings, as well as the individual project rankings the individual project applications are available for public reading at durhamcoc.org in the funding, under the funding page of the website.
Thank you, Lloyd, for that presentation. Does anyone have any questions for Lloyd? Okay.
I hope I didn't put anybody to sleep. If there's no questions.
Well, I'm not asleep, so I guess we're okay.
Okay.
All right. Well, thank you. We will move. You're getting ready to speak up again to talk to us about the special NOFO update. So I'll let you go ahead and move on with that one.
All right. Well, I'll continue then into that update. And this one is actually just a few slides briefer. By way of reminder, this was a special competition that HUD released in the latter part of June of this year The due date was October 20th, last week, Thursday. We submitted the collaborative application and the priority rankings with the project application on the morning of October 20th. And the available funding for Durham was over $2,062,000 for the unsheltered homelessness set aside. Nationally, HUD was distributing over approximately $322 million, broken up between most of it going for unsheltered homelessness and $54.5 million available for projects serving homeless people in rural areas of the country. And Durham was only eligible for the unsheltered, or is only eligible for the unsheltered homeless set aside. We had 2 applications, you recall, and recommended, and then the HSAC approved, recommending only 1 project, the street outreach project of Housing for New Hope is being recommended for the entire $2 million+ over for a 3-year grant. And the project application of Housing for New Hope indicates that they intend to award subrecipient grants of $75,000 to Families Moving Forward and $56,000 to Open Table Ministry to have those organizations help them implement more robust street outreach activities in the Durham community if our application wins HUD approval and funding. So, and highlighted that the grant would enable Housing for Hope to expand street outreach services with the hiring of as many as 11 staff. One of the key things we want to highlight in this brief presentation today is that the NOFO is very competitive. You may recall that the NOFO, the funding mechanism and the competition is awarding bonus points to COCs around the nation that have larger numbers of unsheltered people. And so Durham, although we have too many unsheltered people in Durham for our community, I think we'd all like to see fewer, and our unsheltered homeless numbers have increased substantially since the pandemic hit us and the nation in early 2020. We've seen that number nearly double based on our point in time count. Still, we're not eligible to receive any bonus points in this competition. So we're at somewhat of a disadvantage, but we feel good about our overall application, and we'll keep our fingers crossed and, as we say, be cautiously optimistic that we might get this funding. But a big portion of the collaborative application is HUD requiring the leveraging of housing resources by non-COC funded housing, as well as non-COC funded healthcare resources. And we were asked to seek commitments from community partners and the broader community to for this collaborative application around both housing commitments and healthcare, the commitment of healthcare resources to people who would benefit from a project or projects funded under this NOFO. And so we were able to work to get a commitment from the city of Durham to use up to $250,000 annually over the course of the 3 years to fund housing subsidies for people who would be moving from unsheltered homelessness into permanent housing under this NOFO. as well as the Durham Housing Authority, provided a commitment letter indicating that they are willing to apply for a new funding source that HUD is still working to actually make available to housing authorities across the country. It's a voucher similar to a housing choice voucher, but it's called, at this point, called a stability voucher. And we don't yet know the precise number of stability vouchers that the Durham Housing Authority will be eligible to apply for in this competition, but they've indicated that they're willing to apply for those stability vouchers and work with the COC to prioritize those vouchers for unsheltered households and accept referrals from the COC for these stability vouchers in a way that that would be a mutually agreeable way. So we did get those commitments for the leveraging of housing resources. And then for the leveraging of healthcare resources, we received commitments or letters of support from the 4 organizations listed here. And we're very pleased to have these letters of support. They're significant in very many ways. We're particularly excited. Members of the HSAC may not yet have heard about the Duke University's School of Nursing receiving a grant to, say, a 3-year grant that will make it possible for them to put a mobile medical clinic into the field throughout in Durham and the surrounding areas. I believe the clinic will begin operating around May 1st of 2023, and there are the precise schedule of how that clinic will rotate throughout the community and throughout Durham and the surrounding communities has not yet been established, but we certainly will be working closely with the Duke University School of Nursing to have that clinic available to unsheltered people in Durham. And certainly if our collaborative application is funded, and this project is funded, it would be also available for people who benefit from the grant under this NOFO. And that's all I have by way of slides. So I'm going to stop my sharing, but I'm happy to take any questions about that or the previous presentation if anybody has any questions.
There was a comment in the chat earlier. Drew Oaten said, "Thank you for all your hard work, Lloyd, especially with the supplemental NOFO. That was quite the lift and you handled it wonderfully." Just wanted to make sure you didn't miss that comment.
Thank you. I appreciate that.
Does anyone else have any questions or comments? Ryan, I see your hand.
I was actually just clapping for Lloyd.
Oh, is that a hug? Okay, that's good.
Thank you, Ryan.
Perfect. Okay. Well, thank you, Lloyd, for sharing that information. I appreciate that. And again, I echo the hard work that you've done on that. And the next item on our agenda is a call for new standing committee members. We have my mind just went blank. Policy and Planning Committee and the Performance Management Committees. Y'all have days like that, don't you? When your mind just goes completely blank, even with the words right in front of your face. The Policy and Planning Committee and the Performance Management Subcommittees of the HSAC. We have opportunities for HSAC members and for COC liaisons to serve on those committees. We have room right now for another. I'm going to just combine items 7 and 8 because we're looking for new standing committee members and COC liaisons. If you are an HSAC member and are interested in serving on either of those committees, Jonathan Crooms is the chair of the Performance Management Subcommittee, and Sharita McCullers is the chair of the Policy and Planning Subcommittee. So you're welcome to ask questions about those. You contact them, contact me if you need to, or Colin if you need more information. But we'd love to have you join either of those committees. And if you are not an HSAC member but are a COC liaison, we definitely need you as well. We need to make sure that we have good representation across the COC, not just from HSAC members, but from COC liaisons, to make sure that the things that are discussed and the things that are handled is what is going to meet the needs of our community. So please keep those two areas in mind and let us know if you're willing to serve on any of those. We do have one position available now for policy and planning. We have the guidelines or the rules say that we can have that no more than 30% of the committee can be COC liaisons. So what that means right now is that our policy and planning committee is short. We need another COC liaison right now to make sure that we have enough of you on that committee. So if you are interested, please let us know and plan to join that one. We will move on to the next item on the agenda, which is a discussion about the white flag update. For that, we have Colin Davis. I saw, is that a hand up there? Yeah, go ahead.
It was a real quick hand on the policy and planning and performance management committees. While we're looking for more committee members, COC members are invited to attend these meetings as they are public meetings. COC members, unless you're a member of the committee, you're not able to vote, but you are able to be part of appropriate discussions and helping in policy formulation. So just wanted to throw that out there.
And that's true for any of you. I mean, it's not just but COC, but it's also a good opportunity to see what's going on to decide if you want to be to actually join when there's a position available. Thank you, Colin.
Mm-hmm.
You want to go ahead and go with the white flag update?
Yeah, so white flag this year is going to be a little bit different. As you are aware, we're transitioning back to pre-pandemic levels of funding and pre-pandemic levels of doing things. So we are slowly making that happen. This year is our transition year, and our white flag program, we are not going to be running a congregate shelter at Trinity United Methodist Church this year. We will only be doing non-congregate white flag nights when the temperature is below 32 degrees. And Open Table Ministry will be leading that contract. Families Moving Forward will be filling in a supplemental role with additional family space for up to 3 families at Families Moving Forward as overflow. Open Table Ministry will be handling 15 rooms, 12 rooms for singles, 2 people per room, 3 rooms for families. We will be sending out email notification when white flag is called. That will be coming from us as the lead agency. There will be a referral form. So if you have somebody who you think is appropriate for white flag, there will be instructions on that referral form of how to refer. All of those referrals will go to Open Table Ministry. And since we're calling white flag 48 hours prior to the temperature dropping, there will be time to coordinate and get people there. We will be doing the check-in will be the first night, and if all the rooms aren't filled on that first night, there would be a second night of space there. So we're still working out some of the details of how to do that. I see Sharita's question about number of spaces for white flag. It came down to a budget issue of how much money do we have, how far can we stretch it, and provide appropriate staffing. So with that kind of high level overview, we're planning to start White Flag November 1st. So as soon as we start getting some cold temperatures, be looking for emails from us. And we will be sending those out from now until the end of the cold weather season or until we run out of funding. So with that, in terms of other funding options, I don't have any other funding options. If there's private money out there, folks can put it in there. There was $200,000 available to get us through the cold weather season, which is a sizable chunk of money to get through there, but it is expensive to make it happen. So if you have specific other questions, go ahead, Sharita, what's your question? And I may
So
pass
I
these
think,
to Tammy at the end.
Ebony also had a question. I don't know how you want to go because my hand went up after she had posted her
Go ahead.
question.
Go ahead, Sharita. We said at the beginning that raised hands get priority.
I'm a little bit in distress about this.
Okay.
And of course, you knew I was going to be in distress because we routinely had over 10 families sitting on our unsheltered shelter space wait list in the summer and fall and the early part of this year. And we only have what it sounds like 6 family options.
That is what we have at this point in time. I mean, we can always talk about
We need to come up with some other option because that's not even touching the problem that we have. And so I imagine if we get even more families displaced and our current housing market is getting more concerning by the day, that we have quite a bit of families on the street. I mean, I'm concerned about the singles, but you know, kids on the street in the cold. I don't know. Kids on the street in the cold. We need to come up with some other thing, even if that plan is to reach out to our communities, try to help us. I guess I could bring up Ebony's question as well about how we will notify, you know, Parrington homeless families, how this process will work. But also in the meantime, still trying to work on other options because we know that this is an inadequate number.
well, keep in mind, pre-pandemic, there was maybe 1 or 2 slots. So this is still an increase over what we've had pre-pandemic. I know we're seeing more people experiencing homelessness than we have in the past as well. And historically, our family population has been in the 20 to 25% of the overall homeless population. So proportionately, six rooms and 12 rooms, we're still, we're never going to have enough to get everybody out of the cold. We're doing the best we can with what we have. If we want to talk about saying we're only going to put single or only put family or prioritize families over singles, we can do that.
Commissioner Carter.
Yes, thank you. Just want to follow up on Sharita's concerns, which I'm sure we all share them. And so they raised some questions in my mind. And you sort of answered one, Colin, when I was wondering how many slots did we have before the pandemic? And it sounds like it was a very limited number. Okay. And is there any estimate on cost per slot?
The cost, what a cost per slot would be, like a cost per hotel room night?
Well, whatever it costs for the 6 rooms and the 12, and adequate staffing and all of that. You were saying this is as many rooms, as many spaces as we can provide with this current amount of funding. So I'm just wondering.
Well, I mean, rooms are $85 a night and trying to stretch out. So if you just take the room cost alone, and then you've got case management, supportive services, food, all those other pieces. And Drew sort of an open table sort of budgeted about 2 to 3 weeks every month from November to March. So if you took, 85 times 15 rooms, that's $1,275 a night times, let's call it, even if it's 2 weeks every month, you're at almost $18,000 a month times 5 months. You're at about almost at $100,000, $90,000 just right there. And then you got staff and food cost could easily be substantially more than that.
Well, please monitor, I know you will, how these rooms are filling up, and, I would, don't be silent if there's a huge demand and we don't have any more capacity, within our continuum of care to house people on these white flag nights. Elected officials might want to do something about it in an emergency sort of way. And so, but we have to know. And so please keep us informed.
Absolutely. And we have historically, and Drew can talk about it a little bit more, is historically families have often, even when they're referred, have not shown up. So whether or not they're choosing not to show up or they're finding alternative housing arrangements, there's a big question as to that. So we're making 6 rooms available, and there is a little bit of overflow capacity if weather is getting really, really, really bad, but we're trying to keep some level of social distancing at FMF just for COVID and flu season. But if, we may decide we'll forego our flu and COVID social distancing so that we're able to keep people out because there's, 10 feet of snow and minus 20-degree temperatures. So trying to find that healthy balance as well. And Sharita, I see your question in the chat. First come, first serve. We'll send out a referral. It'll come through. We'll prioritize, obviously, people most likely to have a negative outcome of being out in the cold. So I always use the example of a healthy 25 or 28-year-old individual may not be prioritized over a person who's 85 years old, diabetic, amputee with kidney failure. There'll be some prioritization on that as well.
I don't want to ignore Ebony's question. I know Charita talked about it, but I want to be sure that that question was answered about, will this information be shared in writing to share with parents?
So we're going to be sending this out, and to Ebony's question, this is because we have so few rooms, we would easily overwhelm the system if we just sort of say family self-resolve. So Ebony, we specifically talked about how the school system could refer folks. So if you've got social workers who know that people are experiencing homelessness, I know that you've worked with getting people connected to Entry Point so that they're on that list. Entry Point could submit the referral on your behalf or provide the social worker an HMIS number for the family so that the social worker could submit the form to Open Table for consideration for rooms that evening. And we're also looking at if the family has already called Entry Point and is kind of in that waiting list. Families Moving Forward has said that if people have already been, if Families Moving Forward has said that if somebody's already connected Entry Point and they're not able to get a hold of somebody at Entry Point, they could call FMF and Families Moving Forward would submit a referral on their behalf. Of course, the street outreach teams will be submitting referrals on behalf of their clients that they're aware of that seem to need to be prioritized for those slots. Does that help?
Go ahead, Ebony.
So for clarity, for my families that's already on the shelter list for Entry Point, if they're already on the list, we can refer them back to Entry Point during the white flag nights to have a room. Is that what you're saying? Is that what I heard?
Yes, or if you know that the people are on there, you could potentially reach out to Entry Point now and just say, hey, can we get the HMIS? If you don't have access to HMIS, and I don't think everybody in the school system does,
I don't.
you could just have reach out to Entry Point and say, can we get the HMIS numbers for these families? So that when white flag is called, we have it, because that's the way we're going to do this, because it'll be going through an email system, and we don't want names and identifying information. So that way you would have the client, oh, Susie Smith is HMIS number 12345. So you would just fill out 12345. Here's the contact information, submit it to Open Table, and then Open Table, as they go through the prioritization and answering these questions, they would be able to know who to reach out to and how to work with somebody, because we're trying to give ourselves 24 hours notice of actually being able to get in touch with folks to make sure that they know where to go before it gets cold. So that's why we're calling white flag. So if today is Wednesday, today we would call white flag for Friday. So that gives us today and tomorrow to figure out who's going in, and some time to let people catch up with people who are referred, to say, hey, here's where you need to report to at this time for check-in.
Okay, and my second question is, it doesn't matter about the priority. Do they have to be priority 1 or priority 2? So what's the priority for the families to be accepted into the program?
They have to be literally unsheltered, literally homeless.
So priority 1.
Priority 1, literally homeless on the streets in a car.
Okay.
And then it would still be, if I understood you correctly, when you were responding to my question about this, the first come, first serve part, there would be some look at the vulnerability of that family. So it still doesn't guarantee.
Hmm.
Okay, just
So,
making sure.
Yeah, so if you had a family, and that's the piece, we're still there's some of these pieces that we'll still be talking through, and we'll probably reach out and get some conversations going to sort of figure out, what would most vulnerable look like in a family? Is it, somebody with, kids under the age of 3, do they get a higher priority than having like if I've got 3 kids under the age of 5, or 3 kids that are between 13 and 18, is younger children a higher priority versus older children? Like, are there certain criteria that we feel are more appropriate? Just because we don't have right now necessarily enough money to help everybody, it's which are the ones that are most concerning right now. And hopefully we have a mild winter and we never have to call white flag. But we've already had some cold nights, so I suspect we'll have some.
But Colin, that's also only for the days that white flag is called for. So if we had 3 days under 32, that same person that gets it on day 1 would keep it for those 3 days, correct?
Correct.
Okay.
Yeah, you'd be in there for the 3 days. Then the next go around, it would shuffle around. Good questions.
Yeah.
I just take a deep breath every time. Oh, it does something to my nerves.
I know it's awful. And we don't have non-congregate space big enough to take, to do like a no turn away. If we had enough non-congregate space that you could just sort of say, all right, everybody's welcome in, and we'll just pack in like sardines to get out of the cold. But unfortunately with COVID, that kind of rules out the packing whatever space you have with people. And the system's just not set up for that right now. I will reach out to a rescue mission and see if they're planning to do anything. And see if they're willing to do anything during white flag nights, but I haven't had time to talk to them yet.
Go ahead, Ebony.
Okay, I think I share the same sentiments as Sharita, because it's really difficult when families are calling when they're in the car. So it's really difficult to hear those conversations, refer to Entry Point. There is no space at shelters, refer, they possibly not have a space for White Flag Night. So my question is, and I appreciate Collins, everything that you and your team have done, not taking anything away from what you're doing and what you have done. I guess my question is for future, have we had, and I'm just thinking big, have we had a community meeting like with churches that we can utilize their buildings, utilize the gym, just so that we can get people and their families off the street during those cold nights?
I have not had those conversations. I don't know if Carolyn, Lloyd, Ryan, there's a few people who have been around and in the homeless system much longer in Durham than I have that might have some input whether or not churches have opened up doors. Some of those, and my experience in other locations is when churches are willing to open up their doors, they just need staffing to open them. And it comes down to, is there a are the churches willing to staff it with volunteer they're congregation members, or are they expecting professional homeless service providers to assist in staffing their emergency shelter open ups?
Carolyn. You're on mute, Carolyn.
I couldn't figure out how to unmute it. I think that it is a very, very important thought that churches might be able to open their doors. But the experience that I've had the last two winters is that it takes experience, it takes security. The people that would come are not just the sweet mamas with their darling children. It's not that way at all. And it is really necessary to have substantial staffing and substantial security available. So although I'm praying for a mild winter and see that our first real cold snap is not going to be till mid-December, it seems, if the forecasts are correct. I'm hoping that there'll be enough warm nights that we'll be able to add rooms on the cold nights and still stay on budget. But the truth is that just opening it up is just not that simple.
Russ?
Sorry, one was just to add, I mean, we had conversation with a number of congregations, but it was back during COVID. So there were some limitations. I mean, I think one of the things we face is every year we have this conversation in late October, when it's really too late to do a lot of extensive planning based on the understandable reactions we have. So I don't know what committee this would fall to, if it's planning and policy. It sounds like a planning need, possibly. For us to look at some other options. Winston-Salem has a very well-run, largely volunteer-driven version of White Flag shelter that they run each winter for these kind of needs. So I mean, we may need to find a way to put some of this energy toward planning for the future, because we do kind of, just because of so many priorities, we end up having this conversation every October. The other thing I was just going to ask quick is, do we have a way, and a number of us have said that part of what we seem to run into is a lot of families do self-resolve. Do we have some way to be tracking this year? Like, we set aside X amount for families, we get Y requests, and how those relate to each other. Because we have a very understandable emotional reaction to the idea of children being out, but do we have the data to tell us like how many it really is and how many people aren't able to self-resolve beyond who we can host?
Colin or Lloyd?
I don't have any concrete data, and I'm not sure that we have a report. I'm not sure that we could pull that data from the HMIS, because everything in the HMIS is by self-report. Housing for New Hope, when they were doing check-ins for White Flag, have their experience / anecdotal / limited data points. Open Table has their limited data points of how many families were referred and how many showed up, but I don't know that there was ever a formal tracking, or that we have a formal report anywhere that could say, oh, out of 10 families referred, only 1 shows up, or is it out of 10, 8 show up? I think it's somewhere in between that number and probably on the lower side of it based on what I had heard from the various white flag providers over the last couple seasons.
Thank you. Charita?
I was looking in the comments, and Julia had brought up this point about the county renting the old Boys and Girls Club Center. And then there was this conversation about churches. And I think that, whereas we've had at least Antioch being willing to do this in the past, the challenge has still always gone back to their volunteers and security and things like that. And so, just trying to look at this thing from a different way. Have we ever considered having a space, i.e. the Boys and Girls Club, and then maybe asking the faith community to volunteer their time to work in there at night? Which might be an easier solution than asking all of the individual churches to open up with limited capacity, when we might be able to get some kind of rotating volunteer schedule. Because, we do talk about this all the time. And I think I asked Colin about right to shelter and things like that, probably even last year. That conversation has come up in he and I talks as we kind of talk through agendas and planning for policy and planning. And we keep being here, and it keeps being the same story. There's no money, then there's no place, then there's no people. Like, we always have an excuse. We're not doing a better job. And so we have to figure out how to do better. And that's going to require us to think outside the box and become creative.
And
I'm done.
no, I think you're right, Shrita. We have a challenge with a lot of variables and running a white flag and staffing a white flag. We were fortunate the last couple of years in being able to staff white flag due to the fact that it was open every night for 4 months, essentially from basically December 1st to April 1st. And when you're open every single night, you can provide staffing. If you're not funding something to be open every night, it's very, very difficult to hire a large number, hire staff who are willing to come up with 48 hours notice to come staff something. Could volunteers do it? Absolutely. Could a church sort of say, all right, here's our on-call volunteer, core of recruits who are going to come on 48 hours notice, stay up all night and keep the church open? Absolutely. In terms of what we did to try and plan for white flag, was part of our needing a white flag was to be part of the RFP that we put out earlier this year with, here's money, bring us solutions. And there was one solution that came. So we had to go with the one solution we had. Could we talk about it? Could we maybe get some churches online this year? Maybe, but I think Carolyn brings a good point. And Antioch and others had sort of shared the same concerns in the past is, well, a wanting of, some professional level services there. And right now the money that we have available for white flag is in a contract that could be used for staffing, but is it set up to staff for, overnights at multiple locations? Not right now, but it doesn't mean that it, if there was a way and a will to do it, it could be explored, I guess. But it's not an easy problem to solve because we don't have below freezing temperatures for 4 months straight. It's 2 weeks straight, a couple days here, a couple days there. And we just need to figure out how do we do that?
Russ posted in the chat a resource in Winston-Salem. I'm just scrolling back to look real quick. Sure. one of the problems that we run into in EMS in the middle of the night when we come across someone who's living homeless, living unsheltered, and we've got no place to take them other than the emergency department. And the only reason they call 911 is because they're cold and they have nowhere to go. And even with the plan that's currently in place, there's still going to be nowhere for them to go. And that's hard for me to tell my folks that. I think this is something that we need to spend more time on. I applaud what y'all have done, Colin, because you're working with very limited resources. Listening to what others are saying, I'm wondering if there's, if we were, it may not work. It may not work, but can we approach the community? Can we form like we need one more meeting to go to, right? A task force, an advisory council, something to work on this white flag problem so that we may not be able to do anything this year, but we can plan ahead for next year and get community services. I'm thinking not just churches, but students, college students who are very interested in working with the underserved might be interested in volunteering to work on a white flag night. There's probably a lot of options that we just haven't had the time to explore because we're torn in 20 million different directions. So maybe we can start working on something like that. If not for this year, then at least as to start for next year so that we can have a more robust white flag system next year.
Yeah, I think that's a great suggestion because the funding that we're using this year is really one-off funding. And if this is something that the community wants to continue or expand, if HSAC wants to advocate that we do way more white flag or a no turn away or a right to shelter thing, you're talking, potentially millions of dollars that have to come from somewhere. And does that mean, it may mean needing to cannibalize some of our other homeless programs that are already in place, or pulling money from other places that it's allocated, within city and county spending. So it's how do we do it? I think as we work through our decision tree and figure out the costs and what are things that we want permanently up and running, what are the things that we want temporarily, and what are solutions for all of these? We can sort of put price tags on them and decide, okay, is supportive service, for instance, here's one of the things, great, we stand up a white flag for $200,000 every year in perpetuity. Well, is $200,000 of white flag a better use of $200,000, or is more supportive services for people in permanent supportive housing more important? Is more rental subsidies more important? Where do you draw the line when you're dealing with a finite amount of resources? While they're all really important, and obviously in the cold weather, this is the most important. When it gets nice out, do you want, should there be that kind of money tied up in those resources? But yeah, I appreciate it. Let's figure out a path forward. Does anybody on this call want to coordinate or take the lead on trying to pull together faith community and everybody to start planning for next cold weather season? And if we get enough interest, we might even be able to pilot something during this cold weather season.
I never make a suggestion that I'm not willing to participate in. Otherwise, I keep my mouth shut. But yes, I would be willing to work on that.
Would it be possible for this? Sorry, I may be speaking out of turn.
Oh, go ahead.
Would it be possible for us to set this up somehow as a task force of planning and policy so that it's got some official tie back and kind of get a plan for the timing and stuff like that? Because I know there's several other groups like this germinating at the moment, like, a group to talk about the high intensity unsheltered population that I've heard that come up in the last few days. We probably need to just kind of figure out when we can do these so we can keep them.
Rita,
I'm
what do you,
willing to help too, but yeah.
Sharita?
Yes, ma'am.
Because you're the chair of the policy and planning. That's why I want to make sure that before we say, yes, we'll put this under policy and planning, I want to make sure you're okay with that.
I kind of think that's where it lives.
Yeah.
Just from just the way our system is designed. So if the committee is for us doing that, then yep, sure.
All right. Well, then
And
we
if-
will, go ahead.
I was just gonna say, if anybody is on this call that is not part of policy and planning and would like to be part of this task force, please put your information in the chat so that we can get that information and make sure that when we get meetings set up, because we're gonna need a whole lot more people. The Policy and Planning Committee can't do this by itself. I mean, the Policy and Planning Committee is a pretty small group of people in the scheme of things and all have a lot of other responsibilities. So we're gonna need to spread the love and bring some outside groups and faith community and anybody who can help us pull people in and start helping with pulling things in. Let's see what we can do to make this work.
I think Russ, the field trip could be a part of this planning, definitely. All right, anything else on this? I appreciate the discussion. This has been great. And obviously we're all aware that this is not an easy problem to resolve. Again, Colin, thank you and your team for what you've done so far, because we understand about the limitations of funding and you have to make the best decisions that you can with what you've got to work with. But as a community, I think we can do more. And there's a lot of people out there who want to do things, who want to help. We just have to let them know where the needs are, and they'll jump in. Maybe not robustly sometimes, but they'll jump in. All right. Thank you. We are on our next to the last item on our agenda. And this is another opportunity for discussion. But thank you for those who are putting their information in the chat. This is a solicitation of HSAC discussion topics. At our last executive committee meeting, we were talking about things that HSAC and CSC members would like to know more about, and what kind of education, what type of information can we bring to you during this HSAC meeting that will help you to learn more about homeless system, the different components that go into that, the different needs and things like that. So what we're looking at is a discussion about topics for the HSAC to learn more about to learn more about, to help remain current on trends, regulations, and or areas of interest related to homelessness. We've got a bunch of topics that we talked about that might be interesting. So you're welcome to expand on that. I'll just kind of go through what is on the list that we have right now, like the role of HSAC, the role of the HSAC, the role of this continuum of care, the role of the lead agency. Because sometimes I think those get a little confused. We don't always know exactly what it is that we're supposed to be doing, that each component is supposed to be doing, is what the responsibilities are. Housing choice vouchers and housing subsidies and what supportive services are available for each type. Gaps analysis planning, types of housing, interventions, compare, contrast, how to use them. Unsheltered information from the special NOFO, harm reduction, trauma-informed care and chronically homeless, low barrier shelter, best practices for projects, review or updates of written policies and procedures, new drugs or substances, mobile clinics, and community safety department. So a lot of those different topics. I don't know if Melissa had a chance. Look at there. I asked her, thank you, Melissa, because I asked her at the last minute a while ago, private chat, would it be possible to put these ideas in a list in the chat when we get to this? And she stepped right up. So thank you for that. These are all the things that we had already thought about. But I know that you have other ideas and things that you would like to know more about. So please, if you can think of things that you would like to add to that list, let us know. You can let us know now if something comes to mind. type it in the chat, whatever is going to be easiest, because we want to bring items to you that are interesting and that you want to know more about. Now you also see that Melissa put a poll in, which I didn't ask. This is awesome. I didn't ask her about that. So this is even going above and beyond. So look at the poll, and if there's something that is particularly interesting to you right now, go ahead and check that, and that'll give us an idea of what to work on first. And so we can start working on bringing this information to you. So take a minute, look at that, click what's interesting to you, and we will see what we can, what you want to move on first. I'll just give you a minute. Okay, so we will definitely add that, Ebony, the McKinney-Vento and homelessness in Durham Public Schools. Very important information and something I know very, very little about. All right, progress on targets contained in the housing bond. Okay. So while y'all are continuing to your poll and putting your ideas in the chat, thank you so much for that, because that's really going to help us with planning for future meetings. I do want to make one quick announcement that I have, and then I'll open the floor for other announcements. We are still, our community paramedics are still working with public health to do flu clinics, and we're including COVID vaccine. I mean, the focus is flu because it's flu season, but every season is COVID season now, right? But we are working, we're still doing flu clinics. We've done one for Open Table. We have another one coming up. We have two more coming up for Open Table, actually. We've done two for Urban Ministries. We're getting ready to be talking with Durham Rescue Mission to do flu clinics for them as well. So if there are opportunities for us to assist your population with flu clinic, please let us know. And we can do that. We can try to include that. We want to try to go ahead and get as many of those done as possible. You know, flu season started early this year, so we were actually already behind on getting those vaccines in, but we want to try to do that. Do we have any other announcements? And then I'll talk about what the poll has said, or I'll get Melissa to talk about what the poll has said. Lloyd.
Thank you, Madam Chair. Want to remind members of the HSAC, as well as other COC members and community members attending today, that we are beginning preparations for the cross COC Housing First evaluation process that the HSAC approved, I believe, back in June of this year. We'll be working with our COC lead agency partners from the Wake Raleigh COC, as well as Orange County COC, to put teams together, and we're hoping to have several teams from the Durham COC participate to evaluate Housing First implementation at COC funded permanent housing projects in Wake and Orange counties. We'll be certainly sending out more information with training opportunities and additional information about the responsibilities. We're envisioning at this point about 8 hours of time being contributed primarily in January and February. Training hopefully will happen by the holidays of December, with the actual work of site visits and communications with the agencies and the projects happening in January and February, with the evaluation to be wrapped up by the end of February.
Thank you, Lloyd. Any other announcements? Okay. Well, our next HSAC meeting is November 16th, a little bit earlier in November, but we have Thanksgiving coming up that month. I will not be here for this meeting. I'm going to miss you guys, but our vice chair, Shay Kennard, will be chairing that meeting for you. I will be in Maryland doing training that week at the National Fire Academy, so that'll be fun. But she'll be doing that for us. She'll be taking over facilitating the November meeting. And I believe that that is all we have. So I will accept a motion to adjourn. Nobody wants to leave?
I would like to make a motion.
Thank you.
And I will second it.
Thank you, Sharita. All in favor, click leave. Have a great afternoon.
Thank you, Helen.